Hello, everyone. My name is Chris Black, and I work in the communications department here at WHO in Geneva. And I am coming to you live from WHO headquarters. And today is International Nurses Day. This is part of the Year of the Nurse and the Midwife, and we are very fortunate to be joined by WHO's own Chief Nursing Officer, Miss Elizabeth Iro, who's joining us remotely from her house. Hello, Elizabeth. How are you? And welcome. Welcome to this live show.
Hi, Chris.
Can you
Thank
hear
you
me
very
okay?
much.
Excellent, excellent. I'm so glad you could join. So today is World International Nurses Day, and this is celebrated on the 200th anniversary of the birth of Florence Nightingale. I'm wondering if you could tell us a little bit about the importance of this day around the world and how it's going to be marked today.
Well, I think, for all nurses around the world, the 12th of May is a very important day to celebrate their professions and to celebrate the work that they do every day. And it's also a day to commemorate the birth of Florence Nightingale, who was a nurse practitioner, who was a statistician, a researcher, and who was a champion of infection prevention and control, and really was the founder of modern nursing. So today, and every 12th of May, every year, we celebrate nurses in commemoration of Florence Nightingale's birth. So this year is the 200th anniversary of her birth. And it is also special for us because we celebrated in the International Year of the Nurse and the Midwife, a designation made by the World Health Assembly last year. And so we're very privileged and honored to have that designation. And I think it also signaled quite a significant movement within the global world of nursing and midwifery. But for us today, it is about celebrating nurses all over the world.
Indeed. I think when we had thought of the Year of the Nurse and the Midwife, we would be in the run-up to the WHA, the World Health Assembly in Geneva. We had planned some big celebrations. But in these times of coronavirus, many of the nurses and the midwives around the world are very busy saving lives and delivering health care on the front lines. I wonder what Florence Nightingale would think of the world that we're in today. What do you think?
Well, I think, I think she would be very proud of what the nurses are stepping up to do in the midst of this global pandemic. I think the nurses are being committed, they're courageous, they are skilled, and they are educated, and they are at the front line. They have responded with a real commitment, bringing the values of compassion and caring into looking after, in response to the COVID-19 crisis. I think it's just incredible what we see now in light of the COVID-19 crisis, how the nurses are stepping up alongside their colleagues and their co-workers to take care of patients that we're seeing being admitted in hospitals globally, and also taking care of those in home isolation, making sure that they're getting the right advice and health messages to keep them and their families safe. So I think, they're champions of infection prevention controls as well. So really critical roles that the nurses are playing in this multidisciplinary team approach that we see all over the world right now. I think Florence would be very pleased to see the efforts that the nurses are making at this time. I think what she would be extra pleased with is if we move forward and use the evidence and leverage this time to actually reform healthcare, because the nurses are also finding some challenges as they are delivering and providing, healthcare for patients affected by COVID-19. There are challenges around shortage of staffing. There are challenges around poor supply of personal protective equipment. There are challenges around mobilizing the coverage of shifts within hospitals. There are also challenges around some physical and psychological distress that nurses are feeling. So I think, we need them to leverage and have the global, the political influence, as Florence did in that time. She influenced and reformed healthcare. So I think, this is the next step I feel that we need to do. So as we care for patients during this time, we also must care for our nurses.
Indeed, those are very moving words. Thank you, Elizabeth. And thank you again for joining us. So people around the world are watching. We're starting to get some questions now. We really appreciate that. So if you have anything you want to ask Elizabeth, if you have stories you want to tell us about nurses that have helped you, that nurses are in your family, or if you yourself are a nurse, just don't hesitate. Put the questions in the comment field on whatever platform you're watching, and we'll relay those to Elizabeth. Let us know where you're watching from and your question or your comment or your story. We would love to hear your thoughts on this important day. Elizabeth, our first question is from Tina Donnelly, and she's reflecting on the profession of nursing and the incredible pressure that they're under. So it's time indeed to thank our nurses around the world. Perhaps it's also time to reflect on what needs to change for them to make their working life, should we say safer, should we say more rewarding? What sort of elements is WHO looking into and working with partners on to help improve conditions for nurses around the world?
I think that's a really great insight, great question. It's as we had planned as part of the Year of the Nurse and the Midwife to really elevate and highlight what more nurses can do to contribute to the global health targets, to universal health coverage and the SDGs. We have planned that year with those in mind, and how do we leverage realizing and understanding that there is a global shortage of nurses. So those were some of the big agendas behind the opportunity that the Year of the Nurse and the Midwife presented. Of course, COVID-19. Nurses responded to COVID-19 at the beginning of the year, and we've put plans on hold in regards to the advocacy work, to the campaign work around the Year of the Nurse and the Midwife. But I think what we have, WHO has done now is actually delivered on the first report on the state of the world's nursing, with a profile of what the reality is on the ground for many countries. And so we intend to take that forward, understanding the challenges that nurses are facing during COVID-19. But to take that forward using the evidence and the data we have from that State of the World's Nursing Report to leverage and advocate and call on governments to make more investment in the nursing workforce, because in the long term, it's not a cost. In the long term, what COVID-19 is showing us is we save lives. We need to be better prepared, and we know where our gaps are. So I think this is about working with countries, with governments, with chief nursing and midwifery officers, with nursing leaders in countries, to work through a policy dialogue based on your priorities and your health priorities in your countries, to come up with some policy shifts that supports the nursing education, the creation of decent work conditions and more jobs. And of course, this calls to leadership within the nursing communities. So I think, there are definitely plans that WHO has that we could work with countries address some of the, the real dire challenges and gaps that we're seeing right now in the midst of COVID-19. I have to say, in next month, we are actually hosting a forum for government chief nursing and midwifery officers, for nurse leaders and nursing associations and midwifery associations, with regulators, and also with the educators, to take this next step forward, so that we are actually doing this in a very what else should I say, comprehensive approach to support countries to make the difference, and call on governments to make the investment in nursing leadership, in nursing education, and in more jobs.
Thank you, Elizabeth. For those who are joining at the middle of our show, this is a special live show on International Nurses Day, and we're so lucky to be joined by WHO's Chief Nursing Officer, Elizabeth Iro. We're getting more and more questions. Thank you, everyone. Sandra, who's from Serbia, Havala Sandra, is asking us, and on your point about education, will the education of nurses, high specialized studies and master's studies in health institutions be recognized? Is education something, for example, that we looked into in the recent State of the World's Nursing Report?
We definitely, we had looked into the education of nurses within countries. We're very pleased to have had some data on this, but at the same time, there are also some gaps that we have found. There are gaps in terms of from within the education capacity itself, with the financing, with the number of graduates, and the number of graduates who are being employed by governments, or where they are actually being employed. I think there are some gaps in regards to the data, but I think it's a data that's telling us at the moment where there are a majority of countries with 4 to 5 year programs, and there are a few countries within the regions that are having 2 to 3 year nursing programs. So it's not a one size fits all. And I think we do encourage that it is about recognizing it through regulations and accreditation. It is about recognizing the competencies of the curricula. And so there are various elements that's been highlighted within the State of the World's Nursing Report. And I think, it is about countries relooking at what countries are actually doing, and then how do we support them in taking forward that the curricula is also taking into consideration the context of where they are in.
Thank you, Elizabeth. On that same subject, but a little bit different, we have Landing Mintech, who's asking us, what can we do to make nursing a more lucrative job? So you've covered education, but if we look at retaining nurses and the wages they make, is this something that needs to be improved over the long term?
I think, what we are seeing in the midst of this COVID-19, we are actually learning that the general public are starting to value the work that nurses are doing. And I think that's really a reflection on the profession itself. We have long been one of those professions that's most trusted by the general public. But I think the COVID-19 and the work that nurses are doing have definitely elevated their status and the value that they bring to the healthcare. So I think, to make it even more attractive, I think, we do need decent job conditions. We do need safe working environments. We do need to have decent paid and be remunerated for the work that we do. And so I think those are really important to make the profession that much more attractive and to retain the nurses within the profession. I think that those are some of the call to actions that we are making to government and to employers of nurses.
Thank you, Elizabeth. Joby George is asking a tricky question for you. What is WHO doing for the welfare of the nursing community apart from publishing policies and practices? So can you think of other ways we're contributing or that we're working with partners to improve the situation for nurses around the world?
Yeah, I think WHO is doing quite a bit in terms of supporting countries to implement policies and to implement strategies. There's a lot of technical support that goes into countries to support them to make the difference to meet their health targets. I think WHO has that mandate, and of course, it's based on evidence, and so I think that's something concrete that I have felt since I've been here within WHO, is that shift to not just talk about the policy and develop the great policies, but also to see how they actually can impact the nurses at the front line. I think that's been one of my major issues, and so with many of my colleagues in WHO. This is what the agenda is under this new leadership with Dr. Tedros, is that impact at country level is what he's asking for, and so that's something very high on the agenda for many departments within the World Health Organization, and definitely one that I'm very, very much in favor of ensuring.
Yes, indeed. In fact, Dr. Tedros, I know how much this issue means to him. Am I correct in thinking that you are WHO's first chief nursing officer? Is that correct?
There have been actually some chief nursing officers within WHO, but I think at the level where Dr. Tedros has placed me, I think it's the first time that we've had a chief nursing officer at this level. So I think that's definitely a signal as to how much he values the input and the difference that nurses are making at country level.
Thank you, Elizabeth. And thank you, everyone, for your questions. They're coming in fast and strong. We really do appreciate that, so keep them coming. Elizabeth, Christina is asking, in which situations can nurses decisively contribute to patient safety at the hospital level? So thinking specifically at the hospital level.
Nurses have a big role to play in patient safety. We're critical. We're almost the last barrier to get through. That we have the opportunity and to pick up errors. So it does, we pick up the errors if it's a wrongly prescribed medication, picking up errors because it's the wrong route that's been prescribed. I think nurses play very critical roles in patient safety. But I think what we're seeing also in the midst of COVID-19 is that nurses are really under a lot of pressure. And so we have to understand that when you are tired, when you are exhausted, and when you are not having enough break between shifts, that can compromise patient safety. So I think this is why it's important that the call to action from employers for decent work conditions is really critical for patient safety. It's critical for nurse safety. It's also critical for patient safety.
Thank you, Elizabeth. Sarita Sood is asking a question. She's using the hashtag AskWHO, which I forgot to remind people to use. So if you're on Twitter, you can use that hashtag and we'll pick up your questions that way. How can we provide immediate training to nurses to overcome psychosocial issues, especially in these times where they're working long hours under many stressful conditions? So there's their own mental health to consider, but also the work that they do to help other people in terms of care and mental health issues. Is there any training resources available for nurses right now?
I think this is a very specific field and very critical. I think in terms of the training packages, WHO has the resources and guidance around supporting healthcare workers in terms of mental support. I think the mental health department has launched a recent publication this week. I think that speaks to mental health support for healthcare workers. But it's definitely one of the critical areas that's been highlighted during this COVID-19. So I'm sorry, I can't give you some specifics in terms of where you can go to find these resources. But if you go into COVID-19 WHO website and go to COVID-19 resource package, you'll probably find these guidance available there.
Yeah, indeed. So the address, for if people don't know it, is www.who.int. And on the homepage there in a big red box, there's a link that takes you to all our information on COVID-19 guidance, news, stories, everything that's gathered in one spot. So you can find that information there. So welcome everyone. If you're joining us just at this point, this is a very special live event. We're talking on International Nurses Day with the Chief Nursing Officer at WHO, Miss Elizabeth Iro. We've got a question from Australia from Michelle, who's asking, how can policymakers use the State of the World's Nursing Report to make improvements required, the improvements that they need to make to improve situations for nurses around the world?
I think it's a very good question because I think this is our next step. This is about how we take it forward to influence the countries, the policymakers, the politicians, the ministries of health, the ministers of health. So I think this is really important that we have a in-country, almost a task force of in-country group that actually can look to use the report and then have it within their context as to what is a priority and have those key stakeholders, have this policy dialogue and therefore make the recommendations for policy changes with policy makers in the midst. So you may have your educators, your clinicians, your policy makers, your nursing leaders, within that task force to really have the conversation, have the policy dialogue using the evidence and the data from the State of the World's Nursing Report relevant to your country. I think this is going to be one of the next steps following the Global Forum of Chief Nursing Officers and the Nursing Association members and regulators and educators forum that we will host next month. And then I think we need to still continue that dialogue within countries. I think that's going to be a key to actually moving forward to making those changes.
Thank you, Elizabeth. You yourself were a nurse for many years. I mean, you're still a nurse, but you were a practicing nurse. We have a question now from Lily Jacob asking about working hours for nurses. She's saying that many nurses around the world are working very, very long shifts, 12 hours, even longer shifts, many, many hours in a week. What would your advice to them be in terms of this period of increased work, and how should they be looking after themselves in this time?
Oh, well, I think, this is, again, one of those policy questions that needs to be tackled in the approach around decent work conditions. we need to actually highlight that if nurses are tired, are exhausted, are not getting enough rest times, are not actually having the breaks for the required uh, um, time out, actually will compromise their health as well as compromise the health of patients. So I think this is an element around policy change.
And another aspect of that is also the protracted nature of this crisis. We've been a few months now into the coronavirus response, and we've got much more work ahead of us to do. So we have to have a thought also for the long-term health of nurses and midwives around the world. We mentioned before this is the year of the nurse and the midwife. What do you think this focus on this nurses at during this time will do? It's a unique opportunity in a way to give more attention to this vital issue. What is your hope that what will come out of this at the end of this year?
Well, I think designating the year of the nurse and the midwife was putting the spotlight on nurses and midwives by just that designation. I think COVID-19 actually has really highlighted the profession. And so, for me, beyond 2020, I'd really like to see that there are policy changes that we can make some reform around health reforms around, again, the nursing workforce, the health workforce in total. There has to be investment in the overall health workforce because, nurses are a critical component of that team approach. So I think what I'd like to see beyond, the year of the nurse and the midwife is probably to 2030 in the decade, is that nurses will, governments and employers will realize the long-term benefits to their investment in nurses, in their education, in their jobs, and into their leadership. That's what I'd like to kind of see, that reform happening beyond 2020.
Thank you so much, Elizabeth. David Mwanda, who's writing us today from Nairobi, Kenya, has got an excellent question, asking how can people support nurses in their work? So how can you in the community support nurses in things they're doing? And maybe even to recognize it. Here in Geneva, every night at 9 o'clock, we do some clapping for some health workers, including nurses and midwives. But maybe perhaps more importantly, day to day, how can people support the work of nurses?
Chris, I think those are fabulous. Like it boosts morale. There's this positive public, appreciation of nurses and healthcare workers. I think is just amazing. What I think we need as a nursing profession is the voice of the general public when it comes to those policy changes. I think this is what we need. We need them to be talking to their politicians, to their ministers of health, to make the case for nurses, to support the nurses into having more decent work conditions and into more decent education and continuing education. So I think those are, what I would expect, what I would like the general public to also do. Show the appreciation every day during this COVID-19, but at the same time, use their voice to influence the politicians within their constituencies.
Thank you, Elizabeth. Our questions are really coming in from around the world. We have one now from India, from Gayatri Bala, who says, Happy Nurses Day to you. And what would your message be to frontline workers during this pandemic?
I think my message is one of gratitude. I just want to say thank you to all those nurses who have responded, selflessly, courageously to the care, to continue with caring for people that are being affected by COVID-19. I think, that my message is about gratitude, um, and thank you very much for what you continue to do. I know you are skilled, you are educated, you are committed, and you have the compassion because this is your profession. And so I say thank you for what you do today and every day.
I say thank you to you, Elizabeth, for these moving words. We've had people writing in today from Nigeria, Ghana, Mozambique, Philippines, Sudan, South Africa, Switzerland, Tanzania, Bangladesh, India, Turkey, Australia, Ghana, Indonesia, USA, Italy, and Ethiopia. I know you're going to be participating this evening in a special event here in Geneva. Can you talk us a little bit about the nurses, the role in the Health for All Film Festival, which I believe we're announcing some of the winners tonight. Are you going to be joining us?
Yes, I'll be joining the team as they're the winners of the WHO Film Festival, and then with the category of the nursing and midwifery category. Definitely look forward to joining you all during that announcement. I have to say, as a juror on the selection of the film, I think it's been a really enlightening opportunity for me to see, some of the films, the short clips around what nurses are doing and what's being captured in their everyday life. And I feel really proud to be a nurse. I'm very proud to be a midwife. But I think those films have definitely been very emotionally impacted me somehow.
Indeed, these stories are strong. We've got another list. We're going to go around the world again. These are people who have been watching us today on LinkedIn. Thank you so much for that. From India, Saudi Arabia, Indonesia, United Kingdom, India again, Philippines, Australia, Brazil, Spain, Libya, Nigeria, Iraq, Bangladesh, South Sudan, Ireland, Morocco, Portugal, Pakistan, Afghanistan, Ivory Coast, and Israel. So thank you so much for everyone around the world. Elizabeth, if people are looking for more information, for example, if they would like to read the State of the World's Nursing Report, what other resources are available on the WHO website, www.who.int?
Well, we have quite a few resources. We did create a nursing and midwifery resource center on the website that you can access, where we've posted really a lot of the resources from within departments in WHO that are relevant for nurses and for midwives. So I think, we have that website that you can access a lot of the information, as well as the State of the World's Nursing Report. We also have the Health Workforce site that also hosts quite a few policies and documents that supports the work of nurses and midwives.
Indeed, and the State of the World Nursing Report we worked closely with the International Council of Nurses on that, correct? And perhaps you could tell us a little bit more about our work with our partners.
I think that report was in collaboration with, it was co-chaired with the International Council of Nurses, as well as the Nursing Now campaign. So WHO has been very pleased and very honored to work with these organizations on this very strategic focused document. I think what I have found, last year and this year is just the strengthened collaboration between the global nursing and midwifery communities. It's just been going from strength to strength as we try to align the work that we do to make sure that the emphasis and the amplification of nurses going through the different streams of our different organizations. As some of you may not be aware, the year of the nurse and the midwife, actually at its establishment, the Dr. Tedros called for a high-level steering committee to provide the oversight in the plans and the events and the advocacy campaigns for the year of the nurse and the midwife. So we've been very privileged to really have these organizations come together. Not just ICN and Nursing Now, but also ICM, the International Confederation of Midwives, and the UNFPA, alongside Nursing Now and ICM and WHO. It's just been amazing to see this at the global level. I think what we need to do, though, is to make sure at the global level we have this, but that also it filters down to the country level, and that we're able to support the collaboration as well at the country level.
There is really some incredible networks of nurses around the world, and it's so nice to hear from them on this day. So as just maybe as we move to wrapping this up a little bit, just to remind everyone, this is International Nurses Day, and we're thinking a lot today about Florence Nightingale. 200th year anniversary since her birth, and more than 150 years ago. We have a question from Sagan Narula, who's saying, talking a little bit about her dream. The dream of a type of nursing that would really help people. Do you think we've been able to accomplish her dream, what she envisaged more than 150 years ago?
I think Florence would be very pleased with some of the work I think that we see nurses are doing in the midst of this crisis. I think nurses have definitely stepped up in terms of the services that they're providing and the reach of the population that they are caring for. I think there has been some real significance in terms of how nurses are not just at clinical front lines, but we also have the educators and the researchers that are pulling together the evidence to support the work that we do and to highlight where else we need to keep the focus. So I think, there are definitely the work around the data that Florence did, the infection prevention control statistics that she had. And I think, we just need to keep moving and making that House reform to strengthen nursing.
Thank you, Elizabeth. And thank you so much to everyone who joined us today. Thank you to everyone who asked a question. And thank you also to everyone who just put a word in to thank nurses around the world, to share stories about your experience, not only within these coronavirus times, but also in the past. It really means a lot to us on this special day and throughout the special year of the International Year of the Nurse and the Midwife. Elizabeth, I'm going to ask if you could just give us your thoughts, your one last message for everyone around the world who's joined us today on this day, International Nurses Day 2020.
I think my last thought, Chris, probably would be on a reflection and a remembrance, of Florence Nightingale, of the nurses and colleagues who have passed, not just during this COVID-19 because they've been infected with COVID-19, but who have passed. And I think, we want to celebrate their memories and their lives. And so for me, my final message is about let's celebrate nurses today, every day. Thank you.
Indeed, thank you so much, Elizabeth, for your moving words, and thank you for all the work that you do and for making some time for us today. We look forward to continuing this conversation throughout this year, and we look forward to everyone's comments. To keep them coming, and we certainly are reading them, and we'll get back to you. as we can. So thank you again. Thank you for joining. And hopefully some of you will be able to join us this evening for the results of WHO's Health for All Film Festival. That's starting at 5:30 Geneva time this evening, live on all of our social media platforms. Thank you, Elizabeth. Have a good day, everyone. This is Chris Black saying over and out from Geneva, Switzerland.
Thank you.